Good morning, everybody. My name is Jackie Guerrero. I am the Associate Director of the Equity and Community Investments team, and we're very excited to have you join us this morning to talk about a very important piece of legislation that looks like will be passing very soon. The title of the conversation today is Seeking Relief and Ensuring an Equitable Recovery. This is a primer for capturing the next wave of federal relief funds at the local level, right? So what we're looking at today is looking into the American Rescue Plan to, again, ensure that these dollars that are coming down to the local governments are, being used for equitable purposes and to support communities of color, right, who've been hurt the most by the pandemic. So thank you so much. Daniel, if you don't mind taking us to the next slide. Right, thank you, Daniel. So before we begin, I think it's really good and important practice to take a deep breath and to get centered and present. It doesn't get lost on me that we're nearing the 1 year mark of the pandemic. It is a very sorrowful reminder of what we have endured, especially communities of color have lived through. There have been many people that have been lost, many who have been seriously ill, and others who've lost jobs, right? And all those impacts have really, hurt their lives and their families. So while the vaccine provides us with a sliver of hope, we know that there's a lot more work to be done to ensure that communities of color have access to the vaccine, have ability to continue to stay safe, heal, and recover. If you haven't already, let's take a collective deep breath before we begin. Thank you. Daniel, if you don't mind taking us to the next slide. I think by this point, many of us are familiar with Zoom, we felt it was so important to cover several basics. We invite you again to stay present for the conversation today. We've had attendees muted and your videos off, so you don't have to worry about showing up on the webinar. We're also recording the webinar, and the slides will be shared after this session. We also know that there'll be many questions, some of which we'll be able to answer today, and then others that we won't. So we'll also try to get those questions that weren't answered in the follow-up that is sent. For today's conversation, we will be using the chat and QA functions to engage. So please, drop in questions in the QA button at the bottom or the chat. We'll have our colleague Anisha, who's actually monitoring the chat and QA functions. We won't necessarily, we don't have the raise hand here. So just again, drop in questions there. And then after the webinar, we're gonna share a survey link where we really want to get your feedback. So as soon as this webinar ends, you will see that survey link show up. It shouldn't take more than a minute at most. So please help us by filling it out. Thank you. We can go to the next slide, please. Right, so we have a really awesome slate this morning of speakers. I introduced myself earlier. I'm Jackie Guerrero. I'm with the Advancement Project here with the Equity and Community Investments team, or ECI for short. And we're the team that really focuses on tracking local government spending, local government dollars, and working with community-based organizations to secure those dollars and move them towards equity, right? And so we do this work all across the state, and we're very excited, again, to be able to bring this webinar to you all so that way you can incorporate it as part of your advocacy. We also have from the ECI team, my colleague Anisha Hingorani, Daniel Worley, Mayana Kalfani King, and then we also have our colleague Alicia Mulholland Graves from our research and data analysis team within the Advancement Project, who has an awesome tool that she'll be sharing. That again, all of this is we're hoping to give you all important information you can take and run with. And lastly, we have our awesome and special guest, Giovanna Morales Tilgren with the Leadership Council for Justice and Accountability, who is joining us today to talk about a campaign she was a part of in Merced County to win CARES Act funding. We felt like really centering the CARES Act advocacy and just unpacking how that went last year, that information may be helpful to carry over into this next round of federal funds. And so, like I mentioned earlier, I'll be your moderator today, and Anisha will be monitoring the chat and QA function. So thank you. So a few items to review from the agenda. We already did welcome and introductions. Today we'll start off, kick it off by just previewing what's in the next round of federal COVID-19 relief package. Specifically, our conversation today is focused on the local aid component, though we do talk briefly about what is in the overall package. Then we'll go into a recap of just what we know about the racial and economic impacts COVID-19 has had on communities of color, the local response, and then again, we'll be previewing that statewide tool that our colleagues developed that we hope you can utilize in your advocacy. From there, we'll shift to lessons learned from CARES Act spending, and then spotlight our partner, Giovanna, again, through her work in Merced County. Then we'll recap the conversations with recommendations for how you can secure the next round of federal local aid for your purposes. So again, throughout their presentation, we'll actually be sharing quite a few resource links that you can use for your work, right? We encourage you to check out those links and to share them with your colleagues as well. And I'll just say at the beginning, this is again a preview of what's in the federal relief package. Until it is passed, we'll have an opportunity to really dig into it, but we felt it was urgent to at least get this information out sooner rather than later to make sure that you can begin meeting with decision makers and your colleagues and partners on the ground to make sure, again, that these dollars go into communities. Thank you. You can go to the next slide. So finally, this webinar is actually part of a series. Last year, we did a webinar that provided a budget playbook for outlining how to obtain CARES Act funding. This playbook actually also covered, the dynamics of advocating for revenues during a recession, and so we based a lot of those recommendations as well of what we experienced during the 2009 economic recession. We still think that's a really good resource, and our colleague Anisha will actually be dropping that link to where you can access that playbook in the chat. Thank you very much, Anisha. We also have a Spanish executive summary in case you are interested in doing and sharing that with other folks. Thank you. If we can go to the next slide, please. So let's dig right in. I think this is the reason why we're all here. One thing to update is as of last night, it sounds like this bill is going to be going into the House vote tomorrow. It looks like folks, there's an interest to get that passed. If not tomorrow, the following day. So again, this thing is moving quick, and already we're seeing indications of local governments already making plans for how they plan on spending these dollars. And so, here, we're going to be previewing the American Rescue Plan. You may hear me talk about it as the Rescue Plan in short. So if we can go to the next slide, thank you. So before we actually go right into the details, we felt it was important to make a distinction. There's actually been multiple sources of government COVID-19 relief funds. If we go back to March, in May of last year when the CARES Act was passed, that was a package that was of $2.2 trillion. Then there was another relief package passed in December, so it was at the end of the year. That was around $900 billion. And then the state of California recently passed its own relief package of $7.6 billion. And now there's this fourth package, the Federal American Rescue Plan, which at the time is a $1.9 trillion proposal, though my understanding is that's actually gone down quite a bit after there were some concessions made in the Senate. And today we're going to really be talking about that green box. The thing to really keep in mind is that there's actually a lot of money floating around, right? So the rescue plan is only one part of available funding, but the state has actually made some funding available as well. And there was some, with the passage of the December federal relief, there was some additional money coming down to localities there. So there's actually quite a bit of dollars available. And so, for us, this just really means that we need to make sure that these dollars are going to communities and not just staying within, the government entities to either backfill, losses or things of that nature. And we'll talk about that in a bit. If we can go to the next slide, please. Thank you. So this is just a very high level preview of what is in the actual rescue plan. We know that there are stimulus payments of $1,400. Those checks are going to be going out, they're to still a good chunk of the population, though that was actually, there were stricter income limits placed on that recently through the Senate. We know that there's extended unemployment aid, there's rental assistance and extended eviction moratorium. There's a continued increase in food stamp benefits and nutrition assistance. Again, there's emergency funding for childcare providers. There's also expanded child tax credit, which is actually really interesting. And if you haven't looked at it, there's great already coverage on that that will go to cut child poverty. At least that's what they're estimating. And then there's going to be subsidies for health insurance premiums, restoration of emergency paid leave, small business assistance, supports for vaccines and testing. There's also aid that we're not going to go into today, but again, aid for K through 12 schools around reopening, and that's around $130 billion. Our colleagues with Public Advocates actually did a webinar just last week unpacking that bit. So definitely worth checking out their website to see if you can find out, the recording from that webinar. Then there used to be the 15-hour minimum wage increase. Unfortunately, that was removed in the Senate. So that's not part of the package that will be voted on, hopefully tomorrow, but still worth including in here because it's still important to continue pushing for that. And then lastly, the piece and the reason we're here, right, to talk about the state and local aid that is so critical for continuing to fight back the impacts of the pandemic. Again, this is really, really important to stress that right now, what we have is just a very preview of what is happening, and not until this legislation is passed will we have the final details. But this is what we know thus far. The state and local aid component is actually $350 billion in emergency funding for state, local, tribal, and U.S. territory communities. About 60% of that is actually going to state governments in Washington, D.C., around $195.3 billion. So a huge chunk is going to the state government. So that means that California, the state, is going to get a chunk of those dollars on its own. Then $132 billion is going to go directly to local governments. And there's a pretty exciting factor to that this time around because what we've seen is that now counties are getting dollars, but so are cities. And that 500,000 population threshold that was part of the CARES Act is no longer, right? So now cities are going to get their direct allocation. They're not going to need to wait anymore for the county or the state to provide and pass money down. There's also funding for tribal governments and U.S. territories around $24.5 billion. Then there's actually separate to the $350 billion, there's $20 billion in relief funding for public transit agencies, and then $20 billion for tribal governments in response to the pandemic. And so the money that's going to the tribal governments are really going to be going for supports through PPE, other kinds of things that are required there. So whereas you see it again lifted up in the sub-bullet under the $350 billion, that money is being shared between tribal governments and U.S. territories. So the bottom line here, though, is that that's a lot of money that almost more than doubles what CARES Act provided. CARES Act provided $150 billion. What is included in this round is $350 billion, so $200 billion more. And so that's quite a bit of additional money that is actually going into communities almost immediately. So that's really significant. And what an additional thing I'll say is that this is a local aid component, but there's actually a lot of really fascinating additional funding also being included in the bill that for example, there's $5 billion going to farmers of color who have lost 90% of their land over the past century because of systemic discrimination, right? And some people are seeing that as a form of reparations. because a lot of these families of color are Black who have been disadvantaged. So definitely worth looking into a lot of the legislation, because I think it's been considered very progressive legislation, and when you start to see what it does, it actually does very much look like that. We can go to the next slide, please. So, in total, the rescue plan, like we talked about, is providing a lot more funding for local governments. So some of the allowable uses I think are really important to pull out is that this legislation is now allowing local governments to use the funding to mitigate the public health emergency and its negative economic impacts. So what does that mean? It means that it can cover costs incurred as a result of the pandemic. It can also replace revenue that was lost, delayed, or decreased anchored in pre-pandemic estimates. So what that means is that they can use what they were expecting to get last year pre-pandemic and use those revenues as ways to justify those losses that they experienced. The other thing that we're really keeping an eye on is that the funds are able to be expended over multiple years. Initially, it seemed like it may be indefinite, like there's no deadline for when they need to be spent, but it looks like maybe 2024 is a timeline for when they do need to be spent. So that's something we're looking into. But either way, it's a big difference from CARES, where at the beginning a lot of jurisdictions were just rushing to get money out the door, and well, that was good. It also led though to a lot of decision making without a lot of thought and community input. And also a rush at the end to get any leftover funds out. But that obviously causes a lot of strain for folks who are actually doing the work of getting those resources out. So it does not look like that's the case this time around. The other important thing to lift up, and I kind of talked about this already, is that before the allocation methodology for local governments was any jurisdiction with a population over 500,000 got direct funding from the federal government. This time around, that's changed. So half of the local government aid will go to counties using a CDBG allocation methodology. And then the other half will actually go to cities and municipalities of 50,000 people or less, using, again, a CDBG formula. And I won't go too into detail about what's the CDBG formula, but it takes into account population size, people in poverty, overcrowded units, also older housing units, and things of that nature. And so whenever HUD, the Department of Housing and Urban Development, uses this formula, they just take they use one of two formulas, and the one that produces the most money for that municipality is what they end up awarding them. But bottom line here means that, again, these cities that before were left out are getting direct funding. So that's very exciting. And we'll talk a little bit about timeline of when we can expect those dollars to hit. But ultimately, there's just a lot more money going out, sooner. We can go to the next slide, please. So for California, the estimate allocation. So again, this is the state portion, but also then what's going to metro cities. So larger cities. There's also the other non-counties, which is really smaller cities, and then counties. Is a total of $42.3 billion. And this is an estimate coming out of the House of Representatives as of the 25th of February. And just so we can see here, a lot of the money is going straight to the state. Then there's another chunk, around $7 billion, going to metro cities, cities the size of like Los Angeles, and then counties, which is $7.7 billion, and then other smaller cities. So good, just a lot more money coming down to the state. We can go to the next slide, please. So this is what we know in terms of estimated allocation by county. So we provided a quick sample of the different jurisdictions that we often work in, or where we talk to partners. And here you see the county listed on the left-hand side, and you see the CARES Act column. That was what was allocated via CARES Act. Then there's a third column, which is the American Rescue Plan. That's what we're expecting to come down. So again, it's a range. You may see that the final amount may be $1 million higher or a couple million lower. Then that percentage increases. Were we seeing how much more funding is coming. So ultimately, we hope that this information is useful for your advocacy purposes. I won't go through every single one here, but the one thing we're seeing is at minimum, we'll see it, more counties will see a 10% increase, though some may do much better under the formula that's used this time around. We're already seeing, again, local governments taking this funding into account, and they're starting to already make decisions around what they're going to do. And we'll talk a little bit about that in the timeline section. If we can go to the next slide. And so here is a snapshot of what the cities are going to be receiving. And so again, we didn't have the CARES Act comparison. LA did get CARES Act allocation last year, but most of these smaller jurisdictions really relied on their counties or the state to give them pass down money. And so this time around, this is money going right into the coffers. This is not including if the state decides to share revenues that they get to the localities, right? So there could even be more coming down to local cities. And my colleague Anisha will actually share the link that we were able to get. It was embedded, oddly enough, in a New York Times article that allowed folks, gave us the ability to look up our own jurisdiction. So, again, we're providing a snapshot. There are many other jurisdictions that y'all are tuning in from. And so this link, as soon as you open it, actually downloads it. There are no malware in there. And again, you can then look at your state and then your locality and see what the expected allocation is there. So please, check that out so that way you can start using that in your work. We can go to the next. It should show up at the bottom as a download. If you look at the bottom of your screen, you should see it. It just starts downloading the Excel document. But if there are continued issues with that, then we'll make sure we, oh, that's interesting. Okay. We'll try to see if we can pull that out. It was working earlier, but normally it just starts to download it. Okay, thank you, Anisha. Great, so let's see, for anticipated timeline. So February was when the Senate and the House were deliberating on the bill. We're in March now. Now there's a rush to make sure that they pass this package by March 14th, which is Sunday. So like I mentioned earlier, they want to pass this by tomorrow, at least what I saw earlier in reporting this morning. And ultimately what that means is there's about 60 days from when this legislation gets passed to when then the money is made available at the local level in May. And so what you'll see then is, this is again an interesting piece where we're seeing some reporting that only half of the funds will be made available in May, and then the other half will be made available 12 months from now. Still something good to keep an eye on, but at least there will be dollars hitting as soon as May. So, June is usually when local governments pass their budgets. So what we hope is that they'll, okay. Oh, that's a bummer. Thank you, Anisha, for checking. I have it downloaded, so I think we'll be sure to share that afterwards in the resources that get sent out. So we're hoping that this, that there'll be more transparency with this round of funding because it is coming right before the June adoption of typical budgets. And so that is a good thing, but that also does mean then that as an advocate from our perspective, we really have from this month to next month to make sure that we're getting our asks in for those dollars to be made available as soon as the new budget is passed. So again, that's why we're bringing you this preview and not waiting until the final thing has been passed, so that way we can help you kind of move quickly in your advocacy. We can go to the next slide, please. Right. So before we go to the next section, are there any questions about the information I shared before I pass it over to my colleague, Mayana?
Hey folks, it's Anisha. So if you have questions, please go ahead and add it to the Q&A button, or you can also drop it in the chat. You can do it now, and we'll also be monitoring it throughout.
And I am so sorry about the link. It was working last night, so not sure what had changed, perhaps in the hosting website. Okay. That's a great question. How can we use this information? Right, and then also, will Congress be using earmarks in the future? I can't speak too much in terms of what the plans will be from Congress's end. I think my understanding is that they're good to help incentivize, certain legislators to vote for a bill. So that's why they're included. But again, I'm not sure if it's going to be a wide practice that will continue happening. Though it seems like the Biden administration is willing to provide a lot of incentives for senators specifically to vote for legislation. In terms of how to use this information, at least on the dollar end, I think it gives us a sense of how much revenue a jurisdiction has available to be able to respond to the pandemic. And because we know that, their local revenues may not be as high as they would like or had expected because of the economic impact the pandemic has had. Without this funding, they may have said, you know what, we don't have additional funding to pay for mobile clinics. We don't have additional funding to pay for mental health counselors. We're strapped for dollars, and so we're just going to do what we can. With this legislation, now there's proof that there are millions coming down to those local governments, and we can push back and in essence say there is money and there's money for this purpose. And what we'll be talking about a little bit is just, in addition to the community stories that hopefully you'll lift up, there's a lot of data to show the impact that the pandemic has had on communities of color. And so you can bring in those dollar informations, you can pair it with that data, the community stories, to really, again, call for investments in specific programs that folks need, right? And so that's an idea in terms of how to use this information. And again, because there is no rush to have to spend it this year, we can really think long-term and pair it with a lot of the systemic investments that y'all really want to see, right? We want to see more health spending at the local level. And so we can almost think about these dollars as a way to pilot some of these programs that we want to stay more permanently. Thank you. So now I'll actually pass it to my colleague, Mayana, to discuss the impacts the pandemic has had on communities of color and the long-term impacts it's had on our economy and our workforce. Thank you.
Thank you, Jackie. Good morning, and thank you everyone for being here. Part 3, we're taking a deeper dive into the economic impacts of COVID and our local government response. Next slide, please. So we see a widening of racial and economic disparities. This is not new information. The graphic that we have here is pre-COVID data, and we see across data points, gender, education, wage percentile, that whites are doing significantly better than people of color, and that has only worsened during COVID. We also see a disparity in stable housing. Black families have significantly less cash reserves. So there was realities of being a paycheck away from homelessness that was realized during COVID. And lastly, we see that people of color have lower incomes and higher rates of poverty and unemployment than white households. We saw an increase in the wealth gap. White Americans have 7 times more wealth than Black Americans, and Black Americans went into COVID with a thinner financial cushion, so it was harder to cope financially. And then lastly, we see harms of race-neutral policymaking. So the implementation of policy is being applied without taking into account race or socioeconomic factors. And we saw that in the way public health tactics to control the spread of COVID was done. Not every American had paid sick leave or could shelter in place. So to combat that, we really need to look at policy development, taking a racial and equitable lens when they're developing these policies to see a real change. Next slide, please. We have a widening of economic disparities. So in general, there's a disparity in our workforce that has been present pre-COVID and present during COVID, and we will see after COVID. Job losses and unemployment were at extreme levels for women in general, but also for women of color. Women lost 5 million jobs in 2020, and these factors were attributed to forced manage of childcare and also teaching duties within the household, but also women-heavy sectors like the service industry were closed. And this graphic shows that we're in a K-shaped economy, meaning that there are certain segments of the population that are faring off better than others. At the top of the K, we have people that are able to work from home and less likely to lose money because of the pandemic. And they're in economic stability. They're able to shelter in place. But at the bottom of the K, we see lower income workers, essential workers that have economic instability, but they're also putting their health at risk for income security. So we see that our economic disparities bleed into our health disparities. So there needs to be a focus on relief and recovery. Next slide, please. Our local government response was basically overview, fixes versus solutions. So our fiscal response led to immediate cuts in services and programs, but we want to emphasize that CARES focused on COVID-related expenses, not expenses overall. We saw local government response included public safety exemptions, small business supports, and short-term patchwork policy changes. But we also saw ongoing transparency, accountability, and accessibility barriers. And in the summer of 2020, we saw racial justice uprisings that elevated justice reinvestments as a long-term change solution. And next slide, please. And we're pairing defund, the police, and justice reinvestments together because money is tied up in systems that contribute to these inequities that exist in communities. So we see justice reinvestment as a solution to defunding public safety, and defund is not a standalone solution. We really want to center community voices when talking about defund and community involvement, and also stress the importance of investing in communities to remove police and ensure community safety. With justice reinvestment, again, we see this as a solution, but we also want to focus investment on care models that give back to communities that have been historically divested in and devalued. We want to avoid replicating an existing broken system and build healthy communities. And we can do this by pushing public policies that emphasize patient care access and social issues to help improve health equity in disadvantaged communities. And this will aid in moving away from our patient economy. Thank you. I want to pass it back over to Jackie.
Thank you, Mayana. So again, Mayana lifted up a lot of really important pieces here. Ultimately, the thing we really want to make sure that is clear, right, is that while these are important resources that are available, ultimately they're still one-time funds. And if we're ever going to get to a point where we're seeing structural change in our local government spending, it's going to have to come from rethinking our public safety, right? Rethinking the role of police and investing in health and upstream services and programs. So really important to underline, ultimately, right, justice reinvestment is where we want to be and need to be, because right now we're always coming up against this issue around not enough funding available for the services that we're calling for. So thank you so much, Mayana, for that great piece. So now I want to pass it over to our colleague, Alicia, who is the Associate Director with the Research and Data Analysis team. She and her team have developed a statewide vulnerability and recovery index, a data tool that identifies the highest impacted and most vulnerable communities, also identifies those communities that need recovery resources to be allocated to them, right? And we want to show you this tool so that you can use it in your advocacy purposes to, again, ensure funding and resources are allocated equitably. And we know, a way to do that, right, is also knowing where to target these funds. So Alicia will be walking us through the tool, the methodology, and provide an example or show you how this information can, you can access it and view it. So thank you so much, Alicia. I'll pass it over to you, and then we'll have time after her portion to just answer other questions that folks may have.
Okay, thank you, Jackie. So as Jackie said, this is a new tool we have. We launched our COVID-19 Statewide Vulnerability and Recovery Index in February. It is an interactive tool on our racecounts.org site that identifies the communities with the highest need throughout the state. So I won't be showing the live site today, but our slide deck includes the link to the interactive report where you can explore the data more and zoom in particularly for your county. So I do just want to take a minute to acknowledge the devastation COVID-19 has had on our communities throughout the state. So these data are really just the tip of the iceberg when it comes to the people, communities, and families whose lives have been changed forever by this virus and the unequal impact it has had on our people of color and low-income communities. So we hope that these data are just an additional resource for you as you share the real narratives of the communities in your area that have been overwhelmingly impacted. Next slide, please. Okay, again, we have designed this index in hopes that community stakeholders and policymakers like you can use it to make sure investments are equitably distributed based on need and the impact of this pandemic. The index takes into account the communities that have immediately been most impacted by COVID-19 and those that may continue to face long-term health and economic costs as our state recovers. The index includes 3 components to take these immediate and long-term effects into account. Each component has its own score and map on our site. The risk component measures the risk of COVID-19 infection. The severity component measures the risk of severe illness or death from COVID-19. And our recovery need component measures the needs related to economic and social recovery. Next slide, please. Okay, before we get to sharing examples of how you can use the index in your local advocacy, we do want to share information about the data. This graphic summarizes the indicators within each component of the index. So each component has about 4 to 6 indicators. We average the scores across these 3 components to get the final index score for each zip code. An indicator is included more than once in our index if it relates to more than one component. So you see a couple of indicators repeated on this slide. You'll see that our indicators range from measuring economic vulnerability, such as poverty and unemployment, to populations shown to have a higher risk for severe COVID-19 illness, including hospitalizations for diabetes and heart attack. We also include other indicators we found in our research to be correlated with higher exposure to COVID-19, such as essential workers and overcrowded housing. Lastly, we include an indicator to take into account the disproportionate impact COVID-19 has had on our Black and Brown communities. So our race indicator includes the average percent of the population that either identifies as Latinx, Black, American Indian or Alaska Native, or Native Hawaiian Pacific Islander. So we do recognize that this measure of race may be imperfect for all areas, particularly those that have seen a higher incidence of COVID-19 for people within the Asian community. So we encourage local communities to tap into local knowledge and incorporate that into recovery planning to truly target groups where traditional data and this index may fall short. So hopefully by seeing these indicators, this gives you some ideas of how you can use the index. For instance, you could use the overall index score or the risk and recovery need components to advocate for rental assistance in particular communities or essential workforce protections. You could use the overall index score or the risk and severity component scores to advocate for equitable vaccine distribution for communities most at risk of illness or severe illness. So each component kind of lends itself to different types of investments and interventions. Next slide, please. So you may ask how we came up with these indicators. So this slide gives you an overview of the process that we use to come up with the list of indicators I just showed you. First, we reviewed the wealth of COVID-19 indices that are already available. We also analyzed COVID-19 case and death data to identify which racial groups were most impacted by COVID-19 infection and death. After gathering the data, we tested the data for its reliability at the zip code level to ensure we are producing stable enough estimates. We really wanted to produce an index at a small enough level that was actionable for community stakeholders, so in this case, the zip code level. And lastly, we ran correlations to see how much each indicator was correlated or associated with COVID-19 case rates. So in the end, we narrowed our list to the 9 indicators across those 3 components I showed you. And so these indicators were selected based on their prevalence in the research or existing data or correlation with COVID-19. Next slide. So next, I want to walk you through some examples of how you can use the index. So here we have zoomed, and this is a snapshot from the interactive site at the link at the bottom. So here we've zoomed in on a portion of the index around the Central Valley with Merced County in the middle. The map shows the overall index results by zip code. The darker red areas signify the areas with the greatest need for support or those that scored highest on our index. The light yellow areas are the areas with a lower need of support or those that scored lowest on the index. We define the highest need zip codes as the zip codes in the top 20th percentile of the index. This map shows that large portions of the Central Valley fall within the highest need category of the index. In Merced, most zip codes fall within the highest need category, with some zip codes in the middle of the county falling within the high need category, the lighter red color. The pop-up on the side shows you the index results for zip code 95365. And also there's an arrow on the map that points to it because it's a little small. This zip code scored in the 99th percentile overall on the index, or within the highest 20% of need. And it's scored within the highest category of need for all other components. This information can be used to make sure Central Valley counties get their fair share of dollars and investments, and to ensure that the highest need zip codes in these counties receive even more support. And so now I'll show you some of the individual component maps so you can further target investments and resources. So this map now shows the results for our risk component. We see this particular zip code scored within the highest category on the risk component, scoring in the 99th percentile again. We see zip codes on the outer edges of Merced County have a higher risk score than zip codes in the middle and north of the county. So zip codes with higher risk scores often have higher poverty rates or higher rates of essential workers than other zip codes. And then zip codes scoring within the highest category in the risk component, they could be targeted with vaccine outreach, education on public health guidance, or COVID-19 related resources using community-based response teams, as these are some of the communities we predict are most at risk of COVID-19 infection. Next slide. So next, this map shows the results of our severity component. So we see this particular zip code scored within the highest category on our severity component. We see zip codes in the north and southwest areas of Merced County have higher severity scores than zip codes in the middle and northernmost portions of the county. Zip codes with higher severity scores often have higher rates of hospitalizations for heart attack or diabetes, poverty, uninsured, or senior poverty than other zip codes in the county. So zip codes scoring within the highest category in the severity component could be targeted with vaccine outreach or public health guidance or health information, as we predict these communities may have a higher risk for severe COVID-19 illness. So next slide. So the final component, the recovery need component. We see that this zip code also scored within the highest category on the recovery need component, or the 98th percentile. We see nearly all zip codes in Merced County have a high recovery need score, with the exception of just a couple of zip codes. So this means that many communities in Merced County may have greater need for economic relief following the pandemic due to a high number of essential workers, high unemployment, poverty, and uninsured population, and a high rate of people of color. While need is overall greater in Merced County, looking across these components can help show which particular communities may have greater need for certain types of support and interventions, whether it be economic relief, vaccine distribution, or worker supports. So you can take these maps and customize your policy recommendations for particular communities in your each of your own jurisdictions. So next slide. So finally, we just encourage you to visit our website, where you can interact with these maps more. You can see results for each zip code. And you're also able to zoom in on your county, zoom in on assembly and legislative districts, and then download the data and read more about our methodology. And lastly, we'll have a webinar on March 30th that will dive more in depth on the index and ways that you can use it and some policy recommendations. So I'll turn it back over to Jackie if we have any questions.
Thank you so much, Alicia. So just incredible information. Again, it's very sad and honestly just painful and hurtful to see this information, but hopefully the funding information paired with the data that Alicia is showing is something you can then utilize in your advocacy, right? We want to make this as simple as possible for you all to be able to move on your campaigns, and really for you to do the organizing and the storytelling and collection. So now we have maybe time for 1 to 2 questions. Yes, again, good reminder, Alicia, and thank you, Anisha, for dropping in. On March 30th, we'll be doing a webinar for, kind of going further into detail on this tool. So actually, we're going to hold back on the questions because we want to make sure we get to our amazing conversation from our partner, Giovanna. So again, thank you, Alicia. Another just update is we were able to upload the Excel document that I mentioned earlier into another way that you can download it. That way you can access your local government funding information if it was not in the preview we provided. Thank you. If we can go to the next slide. So that was a lot of information. Maybe this is a good moment to take one deep breath because there was a lot of stuff here that's very heavy, a lot of information, but we definitely want to make sure that we're in a good and centered place now to think about action, to think about lessons learned from CARES. So I'll pause here for 1 second just so we can take a couple minutes to take a deep breath. Or a few seconds, I should say. Thank you. So now I want to make sure that we can end with the last 30 to 40 minutes of our conversation this morning, looking into what we learned from CARES Act, what we saw where dollars were spent, also where the shortfalls were in spending for programs and services that are needed. And then after we do that quick cover of CARES Act, we're going to go then hear from Giovanna, who did some of the advocacy on the ground. So hopefully you can take away some lessons learned from her work as well that you can use in your advocacy. Thank you. And I'll pass it to Anisha, who then will cover the CARES Act component.
Thank you, Jackie. Next slide, please. Okay, great. So I wanted to spend a couple minutes highlighting some of the major equity shortfalls that we identified in how CARES Act dollars were allocated to help guide advocacy on this next cycle of relief dollars. So it's clear that the CARES Act worked for some agencies, corporations, and wealthy individuals, but it didn't do nearly enough for those who needed it the most. We provided a visual that breaks down the 1.9 trillion CARES Act dollars that was passed last spring. We are focusing on the three major funding areas. You can go to the next slide, and that is the state, local, and tribal government support, individual payments, and small business programs. So when looking at the eligibility criteria and the amounts given, it's clear that the CARES Act did not nearly go far enough in targeting relief to those most impacted by the pandemic. So for example, a greater fraction of businesses receiving Paycheck Protection Program loans were in areas with better employment outcomes and fewer COVID-19 infections and death cases. It's also that the program itself was not successful in stopping or decreasing unemployment, which we covered earlier was largely experienced by women of color workers. These one-time individual payments and unemployment insurance had restrictions that prevented the most vulnerable workers from accessing these dollars. 30% of individuals who lost employment during the pandemic, mostly low-wage workers, do not meet unemployment insurance eligibility. The relief workers experienced was limited, given that the extended unemployment insurance ran out while the country was still experiencing high case rates, deaths, and economic shutdowns. Given these larger issues, in many ways, the CARES Act did little to address underlying structural issues in the economy, further contributing to widening racial and economic inequalities. So now we're going to focus on the government, local, and tribal funds provided through CARES. Next slide, please. Here's a breakdown of how much CARES Act dollars California and local governments received. So the state itself received 15.3 million total, 5.8 billion, billion with the B, 5.8 billion went directly to local counties and cities with populations greater than 500,000. California itself used much of its share to provide direct funding to localities with less than 500,000 residents. And it's important to note, I think we've highlighted this a couple times now, that the funds were restricted to new COVID-19 related expenses only. So you could not use CARES Act dollars to backfill revenue losses or pay personnel that were not directly working on COVID-19 response. This current package, as Jackie shared, will be a lot more flexible. And in addition, there were strict deadlines associated with the CARES Act. Folks were required to spend it down by December 31st of last year. And then in a kind of last minute deal in the December 2020 stimulus bill, that was later extended to the end of this year, 2021. Next slide, please. So we, last fall, our team analyzed CARES Act spending by jurisdictions and created case studies from this data. We wanted to share two examples today, one city example and one county example, to see to what extent these localities prioritized vulnerable populations in their COVID response. Lots of these budget decisions were made and these wins were made through concerted efforts of local advocacy and grassroots organizing. And you'll hear some more of that with Giovanna later on. So advocates in Fresno successfully pushed the city to invest in high need mobile clinics. And that's one of the reasons why we categorized Fresno City here, who received $92 million in CARES Act funding as a moderate equity case, right? Here we show evidence of strategic implementation, some level of geographic targeting, and to meet the level of need that we saw in Fresno and focused on highly impacted communities. So this is a city example, and we would say that, you know, due to a lot of groundwork by community-based organizations, organizers, and advocates, we saw some level of money move towards equity, and that's what we want to see. Next slide, please. On the other hand, we saw San Bernardino County. They received $430 million from the CARES Act. And actually, you know, we wanted to highlight some concerns, one of which being that a majority was put into a special fund called costs and projections with very little details, right? So you see the big portion of the pie chart, that 262 million of cost and projections. So this points to larger issues around transparency and oversight. And then, you know, going back to the American Rescue Plan, San Bernardino County is slated to get $426 million in this next round. So that just goes to show that, you know, oversight and details may not be required. They weren't required in the CARES Act. It's also unclear whether or not how much details governments will have to provide for this upcoming stimulus package. Next slide. So we kind of boiled down a couple of key takeaways from our case studies that we wanted to share with you. One of which is kind of no surprise, transparency issues persisted and prevented advocates from really engaging and informing spending decisions based on community input. Given the constricted timeline, localities often adopted spending plans quickly, and this resulted in losing out on more strategic long-term investments. Community engagement, no surprise, because often the CARES Act dollars was adopted on a different timeline. It was, you know, hard to follow the process for the public, and most jurisdictions relied on an internal process to drive budget decisions instead of seeking public input. And then finally, just this one kind of comparison between city and county implementation. Cities tended to have more equitable strategic allocations and better community level advocacy, pushing for more engagement. And by contrast, because of the counties and their size, reach, allocations to smaller cities and large public health responsibilities were just ended up being more challenging budget advocacy targets. And just kind of overall, what we've seen over the last year working with partners in various jurisdictions across California, we also had some takeaways that we wanted to share from the budget advocacy perspective. So structural challenges, right? COVID-19 deepened structural budget challenges that will take many years for localities to recover from and will hit Black and other communities of color the hardest. One-time relief isn't enough, so we need to look at more long-term sustainable solutions. Inequitable recovery is another big one that we saw. We know that some communities haven't even gotten relief yet. Right? We're seeing compounded effects that the lack of equity focus creates. That is an uneven and unequal recovery. Finally, one of our biggest takeaways, which we'll touch on again later in the recommendations, is through all of this, it's really clear that justice reinvestment, that is divesting from policing and incarceration and reinvesting in essential services and programs that keeps communities safe, is a long-term strategic solution to equitable budget recovery and to undoing systems of violence towards Black and other communities of color. So that's all for my section. I believe we have a poll that we're going to be doing right now, and then we'll turn it over to Giovanna to hear about her work on CARES Act budget advocacy.
Thank you. And if you can take a couple seconds to answer the question of the poll. Thank you, Anisha. Thank you. And if we can leave it open for a couple more seconds before we close the poll. Thank you. Right, so the question is, do you feel like CARES Act funding went to the most important community needs? Wow. So 95% of the respondents, about 40 folks responded, said no, it didn't. Where only a couple said yes, it did. Right, so this poll is very sobering, but is a good reminder, right, of how much work is still left to make sure that not just this round of federal funding goes to the highest need communities, but that future government spending at local level is actually helping communities recover. So now I'm happy and just very excited to be able to pass the mic over to our colleague Giovanna Morales-Tilgren. She is the Housing Policy Coordinator for the Leadership Council for Justice and Accountability. She works with communities throughout the San Joaquin Valley on a variety of housing issues, such as access to affordable housing and fair housing practices. So now Giovanna is going to talk to us today about her experience advocating to win CARES Act funding. So thank you so much, Giovanna, for joining us. And we, again, hope that for folks that are on the webinar can, learn some and take away some lessons from their experience doing this work in the Central Valley. Thank you. So Daniel, if you don't mind taking us to the next slide. And yes, thank you, Giovanna.
Yeah, thank you, Jackie, and thank you all for inviting me to talk today. Hi, and so like Jackie said, we work in partnership with community leaders in the San Joaquin Valley and the East Coachella Valley to advocate for local, regional, and state government entities to address their community's needs for basic elements that make up for a safe and healthy community. So I just want to preface by saying that Merced County is composed of a very conservative decision-making body, staff and supervisors. So we went into this already, knowing that that's how they are. So when we ran our CARES funding campaign last year, it started when we found out that Merced had been allocated $28 million. And we began talking to residents and partners, and we realized the importance of running a campaign together as a coalition, which would be more effective than just one organization or one person doing it alone. And so Leadership Council partnered with 99 Roots, Power California, and Faith in the Valley to form a coalition to ensure we work together with residents and youth in advocating for these funds. We held community meetings whenever necessary via Zoom, obviously because of COVID. And we held these community meetings with resident leaders and youth who guided our work and helped us develop our asks. Because like equity for us meant including the needs and priorities of the communities we work in. And we work with vulnerable populations that are more often than not neglected and overlooked every time the county makes funding decisions. And also the fact that they're never transparent on how they're using these funds. So their priorities were at the forefront of our asks. And so when we were advocating, we asked them to establish an emergency mortgage, rent, utilities, and food assistance program with no less than $6 million in aid. And we wanted them to ensure that residents who were disproportionately impacted and who had not received prior aid were prioritized. We also asked them to establish a program for funding that would have supported residents unable to work due to COVID. And we asked them to allocate up to $5 million and for these supports. We also asked them to create protections for employees by placing an ordinance where if confirmation of a positive COVID-19 case was found among an employee or customer, the employer would have to notify all employees. And the reason we were doing this was because we were seeing a lot of agriculture workers and people that were working in meatpacking industries were getting high rates of COVID in these areas. And so we wanted to ensure that employers were notifying employees, and we were also asking them to let them know that there was COVID-19 benefits available to them, which they were not doing. We also wanted them to provide adequate social distancing to employees and provide PPE, do additional testing sites for farm workers and meatpacking companies during work hours, create a hotline, and ensure there would be punitive measures for employers who failed to comply with this. And we also asked them to establish a COVID-19 prevention program for vulnerable populations, establish a medical assistance program for residents who did not have health insurance and had been affected by COVID, increase access to mental health services by allocating $1 million, and provide at least $2 million in financial support to small businesses and nonprofit organizations. So these were the asks that we had developed with residents and youth. And so when we started engaging with Merced County, this started around late July, early August, and the Board of Supervisors held their first public hearing on August 11th, and they didn't vote until December 8th for a rent mortgage utility assistance program. So it was about 4.5 months of advocating and campaigning. And so the coalition, residents, and youth we consistently engaged with the Board of Supervisors for 4 months, meaning that we would we would either go or call to make public comment on CARES funding. We met one-on-one with supervisors and invited residents and youth to these meetings so they could give their testimony of how COVID had impacted them. We also created a petition where we received more than 250 signatures, where we were asking, the county to allocate these funds to these programs. And we used different media platforms to get our message across. So, there's a newspaper in Merced County called the Merced Sun Star that followed the story and wrote an article about it. And then we went on interviews on TV, like Univision, and we used all the social media platforms to get the word out. We also held a virtual press conference where residents and youth and partners uplifted the urgency of allocating CARES funding to these programs. And so, that's 4.5 months of advocating and campaigning. So midway through this campaign, we had to change our narrative. So at this point, we were, doing research and found out that every county in the Central Valley had allocated portions of CARES funding to a rent, utility, and mortgage assistance program, except Merced County. So that's the narrative that we started using. Every time we spoke to them or we spoke to someone, it was like every county in the Central Valley, was using their funds to help their residents except Merced County. And this definitely caught on by media outlets that were following the story. And it was even brought up at the last Board of Supervisors meeting by certain people who were unhappy about that narrative. And so that was like one of the strategies that we used, or the narratives. And another strategy was to get information. So we collected information from different water and utility companies in Merced County to verify how many residents were behind on their bills. And so we use that data to support our asks. And I think definitely giving them a number of how many people were behind on their bills really heightened the urgency to allocate funding to vulnerable populations through these programs. And I think also in highlighting a certain number of residents who were behind on their bills on like in each district kind of made it really did look bad on that particular supervisor who did not know that these many people needed help with their bills. And so we kept pushing that as well. And so I think for us, it was definitely working together as a coalition with partners, residents and youth to really bring this forward and have, you know, some sort of funding allocated to vulnerable populations. I think for us though, like lessons learned would definitely have been to do a little bit more follow through on the implementation. We could have formed a stronger ask for that because that was crucial in ensuring that vulnerable populations received the help that they needed. And we found that too late when the money had already been allocated. You know, a lot of the families that were really pushing for this and working to get this money to these programs didn't get that help. And so I think that would have been, that's definitely like a lesson learned. And after like, you know, listening to the index, that's something that we'll definitely use for our next campaign.
Thank you so much, Giovanna. I think you shared so many important nuggets of information in terms of how this campaign came together. And obviously it was very comprehensive in terms of the coalition that y'all assembled, to the, you know, organizing strategy with supervisors, and then again, just engaging media in you know, helping share and spread kind of the narrative and data. I mean, y'all had it all, and like you said at the beginning, right? This is very difficult because y'all were really facing a very conservative, you know, board of supervisors, and yet y'all were still able to get, you know, significant amount of funding for rental relief. Daniel, if you don't mind, thank you. So I did want to highlight one thing that you mentioned, and then I want to go to a question that came in. Yeah, so actually, let's go first to the question that came in through Norma, because I think then we can talk about the organizing strategy a little bit. Do vulnerable populations include undocumented families? If so, what was the response by the Board of Supervisors?
Yes, so we definitely, that was one of the groups that we included in vulnerable populations, which were undocumented families, and they often get cut out of a lot of the funding that Merced County, you know, allocates. And so that was our main ask, was that this had to go to undocumented families. There was resistance at first, but I mean, I think after hearing so many residents giving public comment and advocating for undocumented families, they, you know, agreed that this would not, that this would go to undocumented families, sorry.
Thank you, Giovanna. Another question from Michelle is, can you share more details about the type of implementation support you wish you had kind of included or thought about included as part of the dollar amount that y'all were able to win?
Yeah, I think one thing I wish we would have included was more of like getting some sort of like policies or procedures on how the organization that received the funds was going to distribute these funds, who was going to be prioritized, making sure that it was vulnerable populations or families that had not received aid before. And so I think that would have really helped make sure that certain families receive the help.
Right. Thank you, Giovanna. And I think this is a great question, because oftentimes, getting the funding is one win, right? But then often they get funneled through either to another contractor who delivers the actual funds, or it can even go through an agency already within the county department. And that agency may not have the same muscle around engaging with community, or same equity principles in their policy decisions around who gets funding. And so really thinking about those stages is actually really important. So that way the folks can actually see and feel the relief. Of course, it is very difficult to do that in a campaign setting that often has so many components. But some of the early thinking that you can do is excellent, and there are other models as well. That other folks have started to devise. So definitely, not necessarily something we need to recreate the wheel, if you will, but definitely something worth thinking about in the policy design phase. Yes, I had a question for you, Giovanna, around the organizing approach. I think one thing when the pandemic first started, there was a quick shift to doing everything virtually, right? Or using telephones and text messages. One thing in our conversation that really stood out is how you mentioned that in some ways, by going virtual, your coalition was able to engage people from across the county, from rural parts of the county, to actually be part of this organizing. So do you mind talking a little bit more about that and how that has resulted in maybe even growing the coalition that y'all have now?
Yes. Thanks for asking. So yeah, we had to, stop hosting community meetings in person. And so we created a task force. It's the Merced County Community Task Force, which was initially started to advocate for the budget. And, once we found out this money was coming through, we used that same task force to organize and talk to residents. And I think in Merced County, what helped was just, this is something that was affecting everyone, not just like one city or, one group of people. It was everyone. And I think in already coming together with a budget, they saw the urgency, and people were, I think, just seeing that so many other like counties were being helped by their local government except themselves, and they didn't see like what supervisors were doing. They didn't, there was a lack of transparency, and so that really like kind of helped form this task force with community members. And it was really great because a lot of these residents were they're community leaders in Merced County, and so they were able to join and invite other folks to these Zoom meetings, and also bring that information back to their communities for those that didn't have like internet access or a computer at home. So it was, and this coalition and this little task force really, I give them all the credit, because they're the ones that spread the word, told their neighbors, families, friends, and they want to continue advocating for future funding that's coming to Merced County. So
yeah, it's very powerful when more folks can then obviously be engaged and then do that organizing in their communities. Thank you. And so one thing that you may have seen is Anisha dropped in a link. That link is from the National Association of Counties that actually did a look at what other counties are doing across the country, really, for like supports, and they kind of break it out by issue. So there's like housing supports, business supports, and if you click on the county, and they even link it in some cases to the actual like board action, where you can read that information. And again, like being able to see how their people have modeled it, what they've done, reading their policies and procedures may be a good way and a quick shortcut, right, to help your advocacy on the ground. So thank you so much, Giovanna, for everything that you shared. I echo what Brian Mamura shared in the chat. Just incredible work in not a very easy place to do this, type of advocacy, but ultimately you guys were successful. And a lot of it just is due to all that amazing organizing happening on the ground. So thank you so much, Giovanna, for participating and kind of joining us today. Other folks, if you're interested in learning more about that work that Giovanna shared, we'll be sure to kind of share her information as well afterwards, just to get that, be able to kind of hear more from her in that work. So thank you so much, Giovanna, for joining us. So folks, we're really rounding the corner here. After, we heard a lot at the beginning around what is in the relief package, get estimates around funding, how those dollars can be used. And then we got that great tool from our colleague, Alicia. And, again, just lessons from CARES and hearing from the partner on the ground. Thank you so much for sticking with us and hearing all of that. So we're just really going to end with the summary of some of the budget and policy recommendations, again, bringing it all together that we hope you can take with you as you kind of hit the ground running in the next few months with, this next bout of federal relief funds. So I'll pass it over to Daniel, who will end us with some of those budget and policy recommendations.
Thank you so much, Jackie. And yes, thanks to Giovanna as well. I think many of the things she lifted up in that conversation are things that we have heard from other partners. All of these recommendations have come directly from partners and work that we have done with you out across the state in the last year. Some of these will be second nature to you. So if they're repetitive, our apologies. But some of them really did come out of the lessons that you've shared with us that came out of the CARES Act funding. And really, we're trying to lift up best cases in terms of what are things that have been working for you, and even some of the lessons that you've learned and how we can make alterations for this round of federal funding. So again, these are goals. Keep them in mind that obviously local conditions will determine how you go about this. Giovanna lifted up some great examples of how they did it, but here are some that we have laid out. Obviously, keeping a tight advocacy goal and targets that are focused on equity is something that is always helpful. Something that really is crucial, I think Giovanna lifted that up as well, is that really like identifying a key department in which to work with or sometimes to target in terms of things that you would like done differently. So tailoring that ask and really developing an implementation strategy with that department and doing that early on in the budget cycle, because obviously departments are starting to develop their budgets right now for the year ahead. So starting to work with them early in terms of how the federal relief could factor into their plans as well. Grounding the budget ask on available data. Again, the tools that have been shared today, both in terms of the COVID tool that Alicia, my colleague, lifted up, and others that Jackie shared in the chat, all of these help inform the narrative that you're going to be using in terms of making your case. And also keep in mind, this is something that we learned also from the CARES Act, is that really these are large amounts of money, but they are one-time asks. So think about how that will serve your long-term goals, whether it means you want to talk about infrastructure, things that can be built up, but will not necessarily be able to be supported with these federal funds in the future years. As we said, we're still figuring out exactly how long we'll have to spend these funds, but the funds themselves will end. And so it's important to keep in mind how these long-term goals will be served by these one-time asks. Then in terms of also, I think it's important is really identifying what some of those key gaps in services are. I mean, again, this is something that comes as second nature to advocates, but really making sure that the community's needs are being served right now, because as more so than ever, we know that elected officials are a little bit removed from some of their constituents' needs. And again, so the data should be not just in terms of the fiscal data, but also in terms of community needs and what folks are lifting up in terms of their sort of most acute needs. Secondly, is really redefining narratives. And again, this is basic strategy for any advocacy, but it's crucial in this period, because what we find is that public officials, CARES Act reinforced that they don't necessarily have all the answers, and they often miss community needs. But that they often were going off of narratives that were not necessarily in line with what community needed. So one of the things that we often heard is that public officials were talking about with CARES Act is that if they wanted to get it out the door quickly or effectively, that meant that they had to scale back on community engagement. And what we want folks to keep in mind is that that is never the case, is that really engaged communities are crucial to both speed and effectiveness. Not giving community say and input on this on the front end really impacts how effective it is at the back end. And really this narrative of recovery is one that's crucial, as my colleague Mayana and others have lifted up, is that this recovery is not an equitable one. Rarely are they after a recession, but this one is particularly inequitable. So relief is going to be more than just a test, and a recovery is more than just a vaccine. And so it's important to really frame your narrative as this recovery isn't a recovery until everyone in the community has recovered. And that is really going to be the path to recovery, is that equitable recovery is going to have to be specific investments, but also changing the way that the process works in terms of budgeting. And then these are our last two recommendations that we had, is really this idea of is demanding from your local officials is that they invest in holistic health. Again, as my colleagues have lifted up, really this package is much more flexible than the CARES package was. So some of the complaints that we heard in the last round was that government officials were being very tight with how they allocated these funds. They don't have that excuse for this round. This is a much more flexible allocation. So again, it's on advocates to think in terms of how is health being advanced that goes beyond just tests, beyond just vaccines, but also really divesting from those harmful justice models that really have done harm to the community and are continuing to do harm during this pandemic. So pushing for flexible health investments that go beyond COVID-19, really thinking of community health with divestment, is that those two in many ways go very well together, is shifting from suppression to care. And really focusing on closing the gaps between low-income communities of color and restoring those defunded health services. Again, these are things to keep in mind, that the health services spending shouldn't go away when COVID is seen as in the rearview mirror. These are long-term disinvestments that have impacted low-income communities of color. And again, this is the time to reframe not only the narratives around that, but the strategies that local officials take in dealing with public health. Lastly, I will say that what we really have talked about is that this notion of aligning community, and Giovanna lifted this up beautifully, is really that idea of, in this time period more than ever, is that really building alliances that are flexible but also supportive and inclusive is really important to focusing power, and really devising solutions that have to be sort of improvised or innovative that maybe we hadn't done in the past, but really are working. So whether it was the networks that Giovanna and others were pulling together in Merced, or also thinking in terms of how a community budget platform can act as what we call like a gravitational force that pulls folks together, rather than splitting folks apart by their own individual needs. And again, this is crucial in communities like Merced County and others, where the policymakers don't necessarily have a progressive track record of using these funds or funds in general. So it's important that folks band together to really make the case for this should be not just a return to normal or simple recovery, but this should be a true reform and a platform for growth for these communities to move towards both equity and repair. And so those are our recommendations. We will build out all these recommendations, and we will post a longer blog post with a longer one. And obviously most of these are informed by what all you have shared with us. So any thoughts you have as we move through this, this is not meant to be, we have all the answers. These are primarily coming from you. And so we appreciate all of your feedback on this. And I will pass it back to Jackie.
Thank you so much, Daniel. So yes, there's a lot of content here today. Ultimately, our goal here was to make sure that you had some tools, some data, and some lessons from folks on the ground doing this work to take away with you in your advocacy. So Daniel, if you don't mind taking us to the next slide, please. Thank you. So, as we close out, would love to hear from you in the chat. What is one insight that you're taking away with you today? And what additional information would you like to see in future webinars we address, right? So please drop those in the chat box. All that information is incredibly helpful as I mentioned at the beginning, we're keeping a close eye on this, piece of important federal legislation and revenue. So as soon as we have final details in terms of what is included, we'll be sure to, of course, share this information, update you all. So please give us that feedback. We'd love to hear from you so that way we can incorporate the next set of information in future webinars. And you can drop that in the chat. Daniel, if you don't mind taking us to the next slide, thank you. So as a reminder, we have the March 30th is the actual date of the webinar for the tool that Alicia shared. It's titled Prioritizing an Equitable Recovery for Highest Need Communities. So please, if you haven't signed up for that yet, that would be great to sign up for that, since you'll get a sense of how that tool was developed in more detail. And I see here we're already getting really good input, right? Relief is more than a vaccine, helpful framing, recovery. The recovery is in, I think, how critically important the data is in order to tell our stories. The documentation and evaluation of COVID funded projects would be helpful. Thank you. Both quantitative analysis as well as qualitative, like the lessons learned. Yes. Pushing for flexible health investments that push beyond COVID, using data narratives to shape strategy. Absolutely, right? And we can help bring some of that data, but ultimately it's the narratives, the storytelling that is so critical to actually pushing these campaigns to actually get those dollars into communities. Great narrative development. Yes, frustrated to hear that it is not coming until May. Right, there's about a couple months, at least that we've been able to see in data and reporting before the money hits the ground. The recovery isn't over until all within community have recovered, right? Thank you, Sam. Yes, so we will be sharing this link, the recording and the resources that we shared in an email follow-up that goes out. So thank you so much. And yes, thank you, Brian, for the great feedback and input as well. Obviously, this work wouldn't be done without the amazing work that organizers do on the ground every day. So thank you all for joining us this morning. You can follow us at these social media handles. You can also email our team directly at eci@advancedproj.org, where you can ask us more direct questions. And don't forget to fill out the survey. It shouldn't take more than a minute, and we'll show up at the end of this as we close this webinar. So thank you so much, everybody, for joining us this morning. It's been great to have you all, and we hope you've been able to take a lot of really good information with you today. Thank you.